This is the Diversity Matters, Navigating the DEPICT ACT Enrollment Challenge audiobook. Copyright. All rights reserved. No part of this publication may be reproduced, distributed, or transmitted in any form or by any means, including photocopying, recording, or other electronic or mechanical methods, without the prior written permission of the publisher, except in the case of brief quotations embodied in critical reviews and certain other non-commercial uses permitted by copyright law.
About the authors. Mo Peer. Mo Peer, the CEO of PeerMed Group, possesses a wealth of professional qualifications and extensive experience in the life sciences sector, as well as in management, marketing, and finance. He holds a master's in commerce and honors in management and services marketing, and has a strong entrepreneurial flair. Mr. Peer has successfully launched and managed businesses for over 20 years and has received training in value investing from Columbia University in New York. With a rich and extensive background in primary healthcare and clinical trials, Mr. Peer has had the opportunity to work with numerous patients and trialists throughout his career. Through his vast experience, he has developed and implemented systems that effectively maximize marketing efforts while simultaneously prioritizing patient care. His invaluable expertise is of tremendous benefit to Participant Cube, which he co-founded with the goal of providing exceptional marketing and patient care services to individuals seeking to participate in clinical trials. David Mashilo. David Mashilo is an esteemed founder and former CEO of a marketing agency with a special focus on assisting life science companies, including those listed on the stock exchange, with an array of services such as search engine optimization, digital marketing, reputation management, lead generation, and marketing technology. Notably, Mr. Mashilo's expertise in cross-cultural communication has been instrumental in bridging the diversity gap in the clinical trial space, thereby adding significant value to the industry. Currently, he serves as a co-owner of Participant Cube, a clinical trial recruitment and retention organization that harnesses the power of AI technology to deliver optimized outcome. Chapter 1. Examining the DEPICT Act. The unknown. Susan was the head nurse of an award-winning world-class hospital where she worked for several years. After some consideration, she quit her job and explored new opportunities. The hospital's CEO tried to persuade her to stay and offered her two options. Their interactions went this way. CEO, you can stay here, and we'll promote you to Chief Nursing Office, or you can leave and take your chances with something new. Susan, what opportunities are out there for me? CEO, I have no idea, it's an unknown. Susan, I think I'll take my chances with something new. I have a sense my life's purpose awaits me. In the end, Susan left the hospital. She started a new career in healthcare management, delivering 24-hour hospital-level care to patients' homes via a team of nurses, orderlies, and logistics personnel. She faced many challenges along the way, with the toughest being the limited adoption of this new format of healthcare delivery until the advent of COVID-19. Her company was inundated with requests for in-home hospital-level care, and her expertise in this made her a sought-after expert. Years later, her former supervisor asked her what she had found in her new career, to which the nurse replied, fulfillment, but many times people will choose known mediocrity over unknown greatness. When it comes to clinical trial recruitment and retention, it is easy for us to gravitate toward what we are used to. Our encouragement in this book is for you to allow us for the next 4 chapters to take you on a journey to discover new ways to market, recruit, and retain diverse clinical trial participants. This starts with the heading of our first chapter, Examining the DEPICT Act. DEPICT Act. Every good menu has a starter, and our book is no different, so allow us to start on February 3, 2022, when 3 members of the United States Congress introduced the Diverse and Equitable Participation in Clinical Trials, DEPICT Act. This bill was created to promote diversity in clinical trials by requiring enhanced data reporting and providing resources to underrepresented communities. The legislation requires investigational new drug (IND) and investigational device exemption (IDE) applicants to report their clinical trial enrollment targets by demographic subgroup, including age, race, ethnicity, and sex. This is to provide a diversity action plan detailing their steps to reach these targets. A diversity action plan may include demographic-specific outreach and enrollment strategies, study site selection, inclusion and exclusion practices, and diversity training for trial staff. The DEPICT Act is included in the appendices as Appendix A. The DEPICT Act also gives the Food and Drug Administration, FDA, the authority to mandate post-market studies in cases where sponsors fail to meet diversity enrollment targets without providing a sufficient explanation. The FDA will be required to publish an annual report analyzing the progress made toward improving diversity in clinical trials. The FDA will also hold workshops to assess how sponsors improved access to clinical trials in underserved populations by taking advantage of the flexibilities provided during the COVID-19 pandemic. In addition, the Act provides funding for community engagement and outreach efforts to increase the participation of underrepresented minorities in clinical trials and research. Community health centers will also receive grant funding to help them participate in clinical trials and research. The need to increase diversity in clinical trials has been a pressing issue for many years, and requests from sponsors and CROs for sites with diverse enrollment experience are becoming more common. The DEPICT Act will provide an advantage to sites with experience in this area. Industry leaders are encouraged to attend the Diversity Site Solutions Summit to discuss innovative best practices for engaging diverse populations. Industry, sites, and regulators must continue to work together to address the challenge of ensuring diverse representation in clinical trials. The current method of operation for our sites is no longer sustainable. The DEPICT Act brings attention to the importance of considering the diversity of our population. Chapter 2. The Reasoning Behind the Walls. Though the title of this chapter metaphorically uses the wall to describe the blockage that our industry faces, there are plenty of similarities when it comes to diversity recruitment and retention. You cannot build a wall using only bricks, you need materials like cement and reinforced steel, among other items. Likewise, more than one recognized barrier stops people from joining a study. This chapter will focus on three main barriers, namely: 1. History. 2. Education. 3. Media. Barrier number 1, history. The following are some of the unfortunate events that took place that have shaped the views of African Americans in distrusting healthcare systems. The 1840s, the Guinea who took it too far. James Marion Sims was an American physician who lived in the 19th century. He is known for conducting medical experiments on enslaved women without consent to develop surgical techniques for treating various gynecological conditions. Sims' experiments involved performing surgeries on enslaved women, including amputations, without the use of anesthesia. The women underwent repeated surgeries and suffered without proper medical care or pain management. These experiments were unethical and inhumane, and the women who were subjected to them did not receive any compensation for their suffering. Sims' legacy is controversial, as some view him as a pioneering physician who made important contributions to the field of gynecology. In contrast, others view him as a symbol of medical exploitation and abuse. Despite this, Sims has been honored with a statue in New York City. He was also once considered a hero in the medical community. In recent years, there have been efforts to acknowledge and rectify the harm that Sims caused to the enslaved women he experimented on. In 2018, a statue of Sims in Central Park was removed and placed in storage as part of a larger movement to remove symbols of white supremacy and racism from public spaces. 1932 to 1972, Tuskegee Syphilis Cloud. The Tuskegee Syphilis Study was a notorious medical experiment conducted between 1932 and 1972 by the U.S. Public Health Service. The study enrolled 600 African American men in rural Alabama, 399 of whom had syphilis and 201 who did not. The study was designed to observe the natural progression of syphilis in African American men, even though there was already a known cure for the disease. The men were not informed of their diagnosis or given proper treatment and instead were given false information about the nature of the study. The Tuskegee syphilis study had a profound and lasting impact on the African American community. It resulted in many men suffering and dying from the disease and passing it on to their partners and children at birth. The study also contributed to a deep-seated mistrust of the medical establishment among African Americans. It fueled a belief that medical research was being used as a tool of oppression against minority communities. The study was finally exposed and ended in 1972 after being widely criticized and condemned by the public and various health organizations. In 1997, the U.S. government formally apologized for the study and provided compensation to the surviving participants and their families. The Tuskegee syphilis study remains a dark chapter in the history of American medicine and serves as a cautionary tale about the importance of ethical conduct in medical research. It has had a lasting impact on the African American community and is often referenced as an example of institutionalized racism in the medical field. The effects of history. I was dropping off my wife at work while listening to the radio some time ago, and I just happened to hear a debate between two people. The one example that was used will bring the two historical events above into context as to why people hold on to past hurts of this nature. The interviewer said, "A father who steals a bicycle and gives it to his son is making his son a beneficiary of his crime. Thus the rage towards the father gets passed on to the son who unknowingly benefited from his father's crime." Whether we would like to admit it or not, based on the above historical events, clinical trials and the healthcare sector are like a father who stole a bicycle from someone. And even though this happened many years ago, clinical trials are heavily regulated to ensure the safety of participants. The fact that the industry benefits from a dark past creates and will continue to create barriers to entry for the African American community unless we proactively do something about the issue. Barrier number 2. Education. The lack of clinical trial education can have serious consequences. Without a proper understanding of the scientific process and potential benefits and risks, individuals may be reluctant to participate in trials, leading to smaller and less diverse study populations. It is often thought that clinical trial education is only pertinent to individuals who are considering participating in a study. However, based on our observations, even those who have already enrolled in a study can disengage due to a lack of adequate education. This highlights the importance of providing comprehensive education to potential participants and those already enrolled in a study. Chapter 3 presents various educational techniques that have proven to be effective in imparting knowledge and transforming people's perspectives. These methods have been observed to create a tangible impact on individuals. Barrier number 3. Media. The media has a significant impact on shaping public perception and opinion. Regarding the clinical trials industry, media coverage can be both positive and negative. Unfortunately, negative coverage can lead to misperceptions and distrust in clinical trials and the healthcare industry as a whole. One common issue with media coverage of clinical trials is sensationalism. News outlets may focus on the occasional negative outcome or adverse event in a trial without presenting the full context or explaining the rigorous safety measures in place to protect participants. This type of coverage can lead to the perception that clinical trials are inherently dangerous or unethical. In reality, clinical trials are carefully designed and monitored to ensure participant safety and to gather important information about new treatments. Despite the media presenting research negatively, those working in the clinical trials industry bear some responsibility for this perception. This is due to the lack of advocacy and promotion of the industry by those who work within it. It's not uncommon for individuals to passionately defend their favorite football player, even more so than they would defend their own industry. This is surprising given that they likely have a deeper understanding of their industry than they do of their favorite player. Chapter 3. Solutions to reaching out to a diverse population. In this book, we kept the number of chapters brief, as your reading focuses on the solutions to the problem rather than the problem itself. Our solutions are based on our extensive experience running healthcare centers under the PeerMed Group, clinical research sites, and Participant Cube, a specialist clinical trials marketing and recruitment organization. Solutions involve 1. Education and relationship building. 2. Communication. 3. First-class experience. 4. Capacity management. 5. Simplify clinical trials. Solution 1. Education and relationship building. Some years ago, we were involved in a study at the site level, wherein the team required assistance with participant recruitment. We were tasked with helping the site achieve its objective. Upon our initial assessment, we noticed that the site had a diverse team, which we assumed would naturally lead to various potential candidates from different backgrounds. After conducting training sessions with the recruitment and marketing team of the site, we were able to align our goals and work together effectively. The remarkable outcomes were evident, as the team's original target of 220 participants was surpassed by recruiting 660 individuals, which is 3 times higher than their initial objective. This accomplishment was achieved after encountering initial difficulties in meeting the original 220 participant target. What happened? 1. Following a discussion with the site manager and the marketing and recruitment team, we concluded that the root of the problem was not the recruitment team's inability to enroll participants for pre-screening. Rather, the primary issue was the existence of a communication gap between the recruitment team and their site manager. 2. It is common to prioritize the recruitment of a diverse population outside the site, often resulting in neglecting to understand the diverse individuals working within the site. Our findings revealed that the site manager failed to invest time in understanding the cultural differences that existed between herself and the recruitment and marketing team. Because of this omission, the recruitment team received an information session rather than a valuable learning opportunity regarding the study. 3. We adopted a unique approach when communicating with the recruitment and marketing team. Our strategy involved initiating a dialogue that revolved around personal interests, daily challenges, and similar aspects. This approach was intentional, as we believe that understanding the individuals being trained is essential to providing effective training. 4. The recruitment and marketing team appreciated our attentive approach, wherein we listened before imparting knowledge. Consequently, they were receptive to the training and open to incorporating the custom-tailored techniques we proposed, specifically designed to engage the targeted communities. 5. Understanding real-time recruitment challenges also enabled us to give further training to the team to address issues arising to ensure that they are equipped to handle real-life challenges. The lesson from the above is that before extending knowledge and practices to communities, education at the site level promotes diversity and inclusion. By taking such an approach, we establish rapport and build trust, ultimately enhancing the effectiveness of our educational efforts. We earn the privilege of educating individuals about clinical trials by actively listening to and appreciating their perspectives. Through the mutual sharing of knowledge, we were able to deepen our comprehension of one another and forge a robust bond. Solution 2. Communication. Understanding our biases and how our experiences and values shape the lens through which we see the world is essential to communicating more effectively with a diverse audience. We cannot assume that others share our view of the world. Our misassumptions break the connection between us and our audience, sometimes viewed as ethnocentric. We need to study our audiences and scrutinize our words and gestures to ensure nothing in our presentation suggests that we assume our way is superior to how another culture might operate. Below are some tips to follow when communicating with diverse audiences. Eliminate figurative language. Phrases such as, "now the shoe's on the other foot," or "let's hit this one out of the park," are simple statements that we use without noticing them, but these phrases may, at best, confuse audiences from other cultures. Remember that nonverbal communication is critical. Our nonverbal component may reinforce, contradict, or even substitute for our verbal communication, so we must study these cultural differences beforehand. For example, forming an O with our thumb and forefinger, which for people in the United States means A-OK, perfect, or got it, is an obscenity in some cultures, carrying many different meanings. Keep your presentation straightforward and brief. if we talk too much, we will revert to our own dialect and habits, so we should plan exactly what we should say and how we should say it, then speak directly. Ask questions and rephrase comments. Checking in with audiences is a good habit and particularly useful for multicultural audiences. As well, rephrasing comments or questions when audience members give feedback will ensure we understand them well. Research linguistic preferences. Just as knowing nonverbal signs and their meanings benefits us, we must also know different cultures' verbal tendencies. For example, in some cultures, the preferred pronoun is she, whereas, in others, it is he. Still, other cultures vary pronoun usage or use they when possible to avoid gender preferences. From Patricia M. Bueller and Joel D. Wardens, Up, Down, and Sideways, High-Impact Verbal Communication for HR Professionals, SHRM, 2013. People don't care how much you know until they know how much you care, Theodore Roosevelt. Solution 3. First-class experience. Creating a first-class experience for participants is crucial for any study as it helps foster participant loyalty, increase industry reputation, and, ultimately, a successful all-inclusive study. Here are a few key reasons why creating a first-class experience is so important. 1. Improved participant satisfaction. By providing participants with a positive and memorable experience, clinical trial sites can increase participant satisfaction, leading to positive word-of-mouth referrals, which have more power than any social media or billboard ad. 2. Increased retention rate. Participants who have a great experience with a study are more likely to remain loyal and see the study through. Participants will also be able to overlook certain flaws in experience as the standard has always been great. 3. Better brand reputation. Providing a first-class experience can also help enhance the study in clinical trials industry brand image, leading to increased credibility and trust in the eyes of people from different backgrounds. First-class experience can be linked to a story of Ryan found in the Raving Fans book. The story begins with a new manager, Ryan, taking over a struggling service business and implementing the 3 secrets of can-do to transform the business into a success. The first secret is to create a vision of a model customer service experience and make it the standard for all employees to follow. The second secret is to empower employees to wow customers by giving them the freedom to make decisions and go above and beyond in their service. The third secret is soliciting customer feedback to continuously improve the service experience. With these secrets in mind, Ryan and his team work to create a memorable and personal experience for every customer. They listen to customer feedback, address concerns, and consistently go above and beyond to meet their customers' needs. The result is a drastic improvement in customer satisfaction, a surge in repeat business, and positive word-of-mouth referrals. The company becomes known for its exceptional service, and customers become raving fans who are eager to spread the word about their great experiences. This story highlights the importance of creating an experience and a culture of exceptional service. Participants deserve exceptional service when visiting your site. They should never be seen as just a number. Solution 4. Capacity management. Sometimes, research sites have successfully established positive connections with diverse communities such as Hispanic, Asian, African American, and Caucasian and generated potential study participants. However, they still face challenges in enrolling and retaining participants in the study. In this case, you might want to have a look at your capacity as a site. Having too few participants. The lack of study participants can be a challenge for research sites, and sometimes leads are obtained but do not result in actual enrollments. One contributing factor could be the quality of the leads, which can be improved through thorough screening processes like the 2-tier system used at Participant Cube. Another reason for the unsuccessful conversion of leads could be a lack of proper follow-up and attention from a designated individual. Sites tend to get CTAs to call leads and do follow-up calls. The problem with that method is that the CTA has 6 other responsibilities, and calling potential leads is an additional task, not a priority task. When the CTA eventually calls the leads, the person on the other end of the line either forgot that they even requested more information or has lost interest in joining the study, thus losing the sponsor the money and effort taken to generate the lead. To address this issue, Participant Cube has developed an assist a site model to expedite the lead conversion process. Having too many participants. A few years ago, there was a competitive study, and one of the sites wanted to reach its goal of 400 participants, so we assisted the site with that goal. They had participants coming onto the site daily. It would have been this site's dream come true, but it ended up being a challenge for the following reasons. Due to the size of the site, the sponsor did not allocate enough IP, thus, sites had to turn people back home. Not enough people were delegated to the study, so the staff had to do 2 to 3 people's jobs. The site had an issue with the CRO because they were doing the work and felt that the CRO wasn't meeting them halfway. The study was temporarily suspended at the site for 2 months due to the high number of participants and concerns about the data quality. The CRO was worried that the employee-to-participant ratio would negatively impact the data collected. This caused disappointment among those eager to participate in the study. As a result of this experience, we strongly promote proper site capacity management, which benefits the site and protects the industry's reputation in the local community. Solution 5. Simplify clinical trials. People are often attracted to simplified things because simplicity is associated with clarity, ease of use, and efficiency. Simplified things are often easier to understand and use, requiring less mental effort and attention to process, making them more appealing and accessible to a wider range of people. In contrast, complicated things can be overwhelming, confusing, and time-consuming to navigate. They may require more time and effort to learn and use effectively, which can be a barrier for many people. Instagram is a perfect example of this simplifying process. Their app Burbn, now Instagram, was going through a difficult time. Even after having seed funding of $500,000, they had a shallow user base. However, they made serious changes, and today Instagram's strategy of simplifying their app and removing certain features aimed to improve the user experience and increase user engagement. By removing clutter and making the app more visually appealing, they created a more seamless and enjoyable experience for users. Additionally, they focused on developing and enhancing the core features that users found most valuable, such as photo sharing and liking, and introduced new features gradually over time. This approach helped Instagram attract more users and retain existing ones, contributing to its significant growth over the years. We cite this example to underscore the apparent reality that the population who utilizes Instagram aligns with the demographic we seek to recruit for our ongoing studies. Should they have declined to use a free chat application owing to its intricacies, it stands to reason that they may similarly demonstrate a lack of enthusiasm for enrolling in a clinical trial. What factors contribute to the complexity of clinical trials from the perspective of the participants? 1. Clinical trial jargon. Using complex jargon in clinical trials can often lead to confusion and may deter potential participants from enrolling. Upon joining the industry, it took me approximately 1 month to grasp just half of the terms frequently employed by the clinical trials team, including but not limited to ICF, IP, CTA, QC, DC, randomization, and blinding. It is important to be mindful of our language and strive to simplify it where possible to enhance accessibility and facilitate understanding. Assumptions. The assumption that people understand clinical trials is incorrect, and we often begin discussions with potential participants without explaining the fundamentals. 2. Despite the availability of information due to technological advances, most people's exposure to clinical trial information is limited. People spend most of their time on social media, and streaming platforms only display content based on users' past searches and interests. Additionally, global search volume research indicates that clinical trials are not a popular topic of interest. 3. Reading. Access to education is considered a fundamental human right, but unfortunately, some people cannot attend school for various reasons, such as moving from countries with limited education access or growing up in impoverished backgrounds where they had to work from an early age to support their families. In such cases, using alternative communication methods, such as videos and audio in the person's native language, would be beneficial in explaining study information. Although reading may seem straightforward to some, individuals with such experiences may find it challenging to navigate. While numerous examples exist, we recognize that each site may face unique challenges in effectively conveying messages to participants. Nevertheless, it is crucial to prioritize simplicity when communicating to attract diverse people. Chapter 4. A passion for work and a love for people. The final chapter of this book will emphasize the significance of possessing both the fervor for work and genuine care for participants, as these qualities should form the basis for every clinical trial site. During my Uber rides, when asked where I was headed, would mention that I was heading to one of the PeerMed branches. Interestingly, I have encountered numerous people from different cities in South Africa who have shared their admiration for PeerMed and even shared personal experiences of taking their families there when they feel unwell. This is a testament to the positive reputation that this healthcare group has earned among people from various regions. We are fortunate to have one of the co-authors of this book and the founder of accompany, PeerMed, that has positively impacted the lives of thousands of people over the past 20 years. Additionally, this individual is a co-founder of Participant Cube, a clinical trial recruitment agency that embodies the same principles shared in the forthcoming story. Why do people love PeerMed so much? That was the question I asked Mo Peer in one of our discussions. He told me the story of a wise man with a passion for work and a love for people. My late father, Dr. Peer, was passionate about helping people. While some may have seen a patient with a cold walking into his office, he saw someone who had likely come from a place without access to clean water. One who woke up early, braved cold temperatures, spent their last money on transportation, and perhaps only had one meal to sustain them. Dr. Peer's understanding of his patients' backgrounds went beyond just their presenting illness. He was driven to ensure that his patients were treated comprehensively, not just for the immediate ailment but also to prevent potential underlying health issues. His dedication stemmed from a deep love for his patients, and his hard work has been carried on in developing our healthcare facilities. What is the importance of this story? 1. Merely recruiting participants based on the suitability of the study to their current health condition is insufficient. We must gather information about our participants' demographics and backgrounds to better understand their unique perspectives and needs. 2. Love is reciprocal. When individuals feel valued and cared for, they reciprocate those feelings toward the brand. To effectively engage with a diverse community, clinical trials must convey that participants are more than mere numbers needed to meet study targets, they are valued individuals. It is essential to reconnect with the fundamental reasons for pursuing a career in healthcare/pharma and prioritize the human aspect of our work. 3. Providing genuine care for people often involves a cost. In typical business operations, it is more practical to solely address the immediate ailment of a patient, allowing them to return with subsequent issues. However, the long-term advantages of going above and beyond for individuals, even when it is not financially rewarding, far outweigh the short-term gains. PeerMed prioritizes patients' well-being over profit and has been in operation for over 20 years, earning trust and loyalty from patients who refer their loved ones to a place where they know they will receive quality care. To bridge the diversity gap in clinical trials, we must prioritize the well-being of our participants. Providing a first-class experience during their site visits, making it our mission to offer compassionate care, and taking extra steps to ensure that they comprehend the purpose of our work are key components. By educating and empowering individuals to make informed decisions about their involvement in our studies, we can work towards building trust and increasing diversity in clinical trials. In closing, diversity in clinical trial recruitment is crucial for ensuring effective and safe treatments for all populations. By including a diverse pool of trial participants, we can ensure that medical treatments reflect different communities' diverse needs and experiences. There are practical ways to enhance your site's ability to recruit and retain participants from a diverse community, but this will require hard work and commitment from each site, not only from the CRO/sponsor side. If you require clinical trial recruitment and retention aid, we encourage you to contact Participant Cube. Our name speaks to our commitment to this critical aspect of the process, and we are dedicated to providing the support and expertise necessary to ensure the success of your clinical trial. Our unique advantage stems from our founding team, comprising seasoned professionals with extensive experience working with multiple clinical trial sites, giving us an in-depth comprehension of the operational difficulties of recruitment and retention. By leveraging AI technology, we can guarantee efficient recruitment and retention while reducing costs and offering fast delivery for sponsors and CROs. Email us at info@participantcube.com. Thank you for listening. Be sure to share the link to this audiobook with other clinical trial sites. The future of diversity in clinical trials is possible if we work towards it together.